Good day, folks. Thank you for joining us here at Your Health. I hope you're having a wonderful Christmas season. You're all tucked in warm and comfortable in your homes, surrounded by loved ones. What a beautiful time of year. Enjoy. It's very special. The older we get, the more we realize that. Isn't that the truth? Well, on today's program, we'd like to talk about the health benefits of magnesium, and they are great. This is a remarkable program full with very powerful information that can improve the quality of your life. So please stay tuned for that. First, let's go to our news. Let's see what's happening in the health world. Even mild physical activity improves memory. Researchers from the University of California, Irvine, evaluated 36 healthy subjects. They conducted both functional MRI imaging of the brain and memory testing. They found when the brain testing was preceded by just 10 minutes of mild exercise, the subject's hippocampus performed better. The hippocampus is involved in making and retrieving memories. The subjects also scored higher on written and verbal memory testing. The study was published by the Proceedings of the National Academy of Sciences. Folks, over the years, we've reported dozens upon dozens of studies that conclude exercise is a vital component of a healthy lifestyle. This is not news to anyone. Most of us have heard the benefits of exercise story time and time again. In fact, we've heard it so often that many may assume we must engage in extreme and difficult exercise for long periods of time and most days of the week to benefit from exercise. This notion is confirmed by the increasingly popularity of extreme athletic activities such as marathons and triathlons and more. There are benefits to doing more, but there are also many benefits from doing just a little exercise as well. Now, I decided early on this program that many of us are put off by the notion that the only exercise that benefits us is the extreme type. And this, of course, leads to no exercise at all for many because we just don't want to participate in triathlons. And if that's what it takes, many just won't exercise at all. And you know what? That's understandable. So here is another chapter in our book on the benefits of doing just a little exercise, but doing it regularly. Here we learn that if we walk for just 10 minutes, it improves the function of our hippocampus, the area of the brain responsible for making and retrieving memories. The explanation for this phenomena is that when our muscles are active, they create neurotrophic factors or hormones that stimulate the production of new brain and nerve cells. Plus, even short periods of exercise increase blood flow to the brain, which provides a long list of benefits. So the expression, if you don't use it, you will lose it, applies to our muscle strength as well as our brain strength. So get up and move. Even if it's just for a few minutes, and even if it hurts a little, it provides vital health benefits. Participating in sports during childhood improves bone mass in adulthood. Researchers from Curtin University in Australia followed almost 1,000 children from age 5 until age 20. They found those who participated in organized sports during childhood had stronger bones at age 20. The study was published by the Journal of Bone and Mineral Research. Related research from the University of Michigan finds nutrition has a greater effect on bone mass and bone strength than exercise. They also found exercise-induced bone strengthening can be preserved with mineral-supplemented diets even if regular exercise has been stopped. This animal study was published by PLOS ONE. Well, folks, this line of research is critically important because here in the U.S., we have the highest rates of osteoporosis or thin bones worldwide. This simple fact alone confirms when it comes to building and keeping strong bones, we're doing something wrong. Our first study finds when children are active in sports, it helps them build stronger bones when they reach early adulthood. And normally, these strong bones then last a lifetime. But here in America, it appears we are doing something wrong because our early adulthood strong bones are not lasting a lifetime, but rather they're weakening into a state of osteoporosis far too often. Our second study helps to provide us with an answer to our problem. This study conducted on animals found when it comes to building strong bones, a healthy diet with supplemental minerals is more effective in building strong bones than exercise. This is what we are missing. Far too many are not effectively supplementing their diet, and we are paying the price with extraordinary high rates of osteoporosis. Most of us know that we need to eat a calcium-rich diet and supplement with calcium and vitamin D to make strong bones. But most do not know that magnesium supplementation produces even stronger bones than calcium supplementation. The ideal is to maximize your bone strengthening plan with regular weight-bearing exercise, even if for a short period of time, and eating a healthy diet and supplementing your diet with calcium, vitamin D, and magnesium. Well, today on Your Health, we'd like to discuss further the amazing health-promoting properties of magnesium. So stay tuned to learn more.
I'm Cindy Becker.
And I'm Dr. Richard Becker. Are you thinking about your health as we approach a new year? Well, many of us do, even though our health is important every day of the year.
If you have a wellness plan in mind, December's a month with special holiday prices. Plus, shipping within the continental U.S. is free for all orders over $50.
We'd like to thank you for your continued support. It's because of you that we are able to provide this great educational service.
So call us today to restock your supplements for the coming year and tell a friend about the savings, or order online at bioinnovations.net for the best prices of the season.
We hope the new year brings you happiness and better health for your entire family. Merry Christmas.
And a happy, healthy new year.
I'm Dr. Becker with Your Health at a Glance. Have you or someone you love recently been diagnosed with cancer? It is projected by the year 2020, some 18 million Americans will be cancer survivors. The main reason for this upward trend is our treatments for cancer are better than ever. Our cancer medicines are much improved, and we know more about how cancer works. In addition, holistic principles of cancer care are becoming standard of care treatment. Plus, research centers are discovering natural substances with true benefits for the cancer patient. This is an age of wonder, as we can incorporate both mainstream medicine and the fields of complementary and anti-aging medicine into your plan to beat cancer. I'm a cancer survivor who's here to tell you that you have more tools than ever in your battle with cancer. For Your Health at a Glance, I'm Dr. Richard Becker. Every day, about 200 million Americans do not get enough of a key essential mineral.
That mineral is magnesium. The typical American diet does not supply enough.
And magnesium is so important. It protects bones and helps more than 300 different enzymes in the human body perform efficiently.
That's why BioInnovations offers chelated magnesium capsules for oral use and topical magnesium gel to be applied to the skin. That's 2 forms of magnesium to meet your daily needs.
Scientific evidence points to chelation as the best method of vitamin and mineral formulation.
So call 888-442-2120 or go online at bioinnovations.net to place your order. Ask about the AutoShip program for additional savings.
Because chances are you are one of the 200 million Americans who need more magnesium every day.
Welcome back and happy holidays, everyone. It's great to be with you today. This show is going to be really a great one. We're going to learn about magnesium. Did you know this amazing mineral is really, really, really important and operates in over 300 processes in our body? Wow, that alone is reason enough to supplement, isn't it? Yes. So, Richard, magnesium, the forgotten mineral.
Yeah, what if I told you that we have a new drug available, and this new drug is so special, it can lower your blood pressure, lower your risk of a heart attack up to 80%. This is all the same drug now. Reduce your risk of osteoporosis, lower your risk of diabetes, and if you are diabetic, you will better control your blood glucose if you take this new drug. It also relieves pain, headaches, fibromyalgia, and restless leg syndrome, reduces wheezing in asthmatics, improves vision in glaucoma, and as many as 260 million Americans could benefit from this new drug. I would want stock in that drug company. That's a good drug. Well, it's not a drug. Nobody owns the patent except for God. It is magnesium. As many as 60 to 80% of all Americans are either deficient or have low intakes of magnesium and would benefit from supplementing more in their diet. It's a remarkable fact. What is magnesium? Fascinating element. 8th most abundant element on the Earth's crust, the 4th most abundant mineral in the human body. The typical human has about 25 grams of pure magnesium in their system. And Cindy, I don't mean to counter you, but we have an update on all the new actions of magnesium. For years, we reported 300 metabolic processes, 300 enzymes. That number is now up to 600 different enzymes have been identified that require magnesium to do their job properly.
600.
600 now.
That's, you've been holding out on me.
Well, this is new information.
This is new information. This is amazing.
It is. And so this translates into thousands of different metabolic processes that require magnesium for proper function. When I think of magnesium, I think of the element, the mineral that gives the spark of life. That's how I think of it, and I've been studying this for many years. It makes sense to me to think of it that way. What else? Magnesium does many things, many things, but we want to highlight a few. Magnesium antagonizes calcium. There's always the push and pull in physiology, right? And calcium tends to clamp down muscles, causes muscles to contract. Magnesium counters that. If we don't have enough magnesium, calcium is allowed to run amok. And this includes hardening of our arteries with calcium. Bony deposits, bone spurs, and things that hurt and causes great trouble. So it antagonizes calcium. Maintains muscle and nerve function, keeps the heart rate rhythm steady. It supports a healthy immune system, keeps bones strong. And it is the most important mineral in keeping electrolytes balanced. If you are having trouble with your calcium or your potassium levels, and you have to take pill after pill to try to maintain your potassium, your sodium, your calcium, think magnesium deficiency, because most doctors never check magnesium. But magnesium controls, if you will, if I may use that term, these other electrolytes in our bloodstream. If your magnesium level is not good, you will never maintain good, healthy potassium or calcium levels. I hope that helps somebody. I hope it helps. Here's a new one. Magnesium controls your cellular clock, your circadian rhythm. When we wake up, when we get sleepy, when it's time to eat, the rhythms of the day, of the week, of the month, of the year, these are all circadian rhythms, and without proper magnesium, that doesn't happen right. So here's the point. Are you having trouble falling asleep? You take a sleeping pill and it helps for a few days, but then it doesn't help at all. You're probably low in magnesium, and if you started supplementing magnesium and restore your body's level, your circadian clock may just return to normal and you don't need those sleeping pills at all. Isn't that amazing? This is a new finding. It controls the secretion and function of insulin. Insulin. Now, zinc is in the insulin molecule, but without magnesium, the receptor for insulin doesn't work properly, nor does the secretion of insulin occur properly. Diabetics, pay attention. It's involved in aerobic energy metabolism. You've heard us talk about ATP, the deliverer of energy to our cellular mechanisms, and how if we don't have enough ATP, we may have angina, and we may have heart problems, we may have other things like headaches, a whole list of no energy to the systems. Well, ATP forms a complex with magnesium that allows ATP to be functional. If you're low in magnesium, you're low in energy. Bad things happen. You don't want that. What else? When you're low in magnesium, you cannot repair your DNA. Life is full of damages, isn't it? These things happen. But we have auto-correction mechanisms to help fix those problems. When there's damage to the DNA, your code of wellness, if you don't have enough magnesium, you're not fixing it right. And what happens? It leads to cancer. That's why populations with low magnesium intake have higher cancer rates. Makes sense. Magnesium activates the B vitamins. It assists in blood clotting, and it helps to prevent clotting needlessly. We need the clot when we have a hemorrhage, right? But we don't need a clot to travel around in our bloodstream and give us a stroke or a heart attack or an emboli, right? We don't need that. Magnesium helps to compensate. It antagonizes calcium because calcium's involved in that blood clotting mechanism. But if you don't have enough magnesium, you clot needlessly. We don't want that. That's bad news. Dietary magnesium is absorbed in the small intestines. It's excreted through the kidneys, the skin, and the feces. The kidneys are in control of regulating magnesium levels. However, I will say this. Some of the most complex physiology I've ever studied is how the body controls magnesium. And we don't know the whole story yet. There is no one hormone that controls it. There appears to be multiple hormones. It's so important that the body cannot trust just one hormone to doing the action. That's how I think of it. We'll learn more about that as the scientists learn how we control magnesium. For now, we mostly have to just supplement more if we're low in it. Dietary magnesium has declined. This is a very important point that everybody needs to understand. Soil depletion. Our farming techniques do not really replace minerals. My mother used to tell me, my mother grew up on a farm many, many years ago. Her father, who was a German immigrant, farmed with the old methods. And he would break seashells into tiny pieces, crush them, and spread them to replace minerals in his croplands. Nobody does that anymore. Nobody does that. And this is why our soils are depleted from magnesium. Also, when you refine foods, when you process foods, you're taking out the magnesium content. So the researchers have determined that our diet in America today is from 60 to 80% lower in the magnesium than it was just 100 years ago. That terrifies me because magnesium is essential for life and wellness. 80% lower. That means if you really want to attain good health, you must supplement magnesium or spend a lot of time finding whole foods, because whole foods have more magnesium in them. Now, one of the big controversial areas in magnesium management is how do we test for it? And to give you a little bit of scientific background to understand how magnesium works, get these facts. 60% of our total magnesium content is found in bone, but that's tied up. It's not active. It's in the bone. 60%. About 39% is found inside tissues, inside the cell. It is the predominant cation, divalent cation, 2+ inside the cells. Only 1% is in the bloodstream. And only the ionic form of magnesium is active. The solution, the dissolvable part, that's the only part that's active. When we test for magnesium, the typical standard old-time blood test tests for total magnesium, not just the active, total in the bloodstream. That's very inaccurate. The body will take magnesium from the bone, release it into the bloodstream because that's where it is critical. It is critical to maintain that. So you can have a normal blood test, but slowly but surely depleting your total body magnesium levels. Therefore, a simple magnesium blood test is notoriously inaccurate. If that blood test is low, it tells you that you are desperately low in magnesium, but you can be deficient and have a normal blood test. Does that make sense? It's imperative that doctors, nurses, and health personnel understand this. We have new tests for it, and we'll talk about that when we return.
I'm Cindy Becker.
And I'm Dr. Richard Becker. Are you thinking about your health as we approach a new year? Well, many of us do, even though our health is important every day of the year.
If you have a wellness plan in mind, December's a month with special holiday prices. Plus, shipping within the continental U.S. is free for all orders over $50.
We'd like to thank you for your continued support. It's because of you that we are able to provide this great educational service.
So call us today to restock your supplements for the coming year and tell a friend about the savings, or order online at bioinnovations.net for the best prices of the season.
We hope the new year brings you happiness and better health for your entire family. Merry Christmas.
And a happy, healthy new year. Cindy Becker for Your Health at a Glance. Are you looking for a healthy replacement for sodas? For thousands of years, the Far East has enjoyed the many health benefits of green tea. Now the Western world has embraced this potent antioxidant for its many health benefits as both a drink and supplement. Green tea has been thoroughly researched. It's been shown to improve bone density and immunity, as well as levels of cholesterol, blood sugar, and blood pressure. Research has also shown it to decrease inflammation and one's risk of cardiovascular disease and many forms of cancer. One recent study even found that people who drink 5 or more cups a day were 33% less likely to develop conditions that cause disability. For health, it is everyone's cup of tea. For Your Health at a Glance, I'm Cindy Becker.
There are thousands of fungal species, and at least 200 of them have been found to cause human diseases.
Fungal infections are common, so what can we do to protect ourselves?
One solution is oregano, a natural alternative. Oregano fights problems created by fungus and yeast overgrowth, and it improves many other health conditions.
At BioInnovations, we offer oregano in gel caps and liquid extract.
Yeast and fungal disorders can improve.
So take charge of your health by choosing a natural alternative such as oregano gel caps or oil of oregano liquid extract. Give us a call at 888-442-2120 or go online at bioinnovations.net. Check out our auto ship program for additional savings. We're back learning about the important mineral magnesium. So Richard, how would a person know if they're running low in magnesium?
Well, if a standard magnesium blood test is low, you're in trouble. But it can be normal and you're still in trouble due to the reasons we just talked about. So what's developing now is a free ion magnesium test, but very few labs do that, but more are coming online. The intracellular red blood cell magnesium test is helpful. That tells you how the load is in the cell, the ionic, the good type that you want to assay, and then a magnesium challenge. We don't have time to explain all this, but doctors, you know what I'm talking about, a magnesium challenge. That's the gold standard to determine. If you suspect there's magnesium deficiency, you're much better off treating for it because it's well tolerated even in high doses. Now, since the blood tests are a little sketchy, I developed a quiz to help you determine whether you may be low in magnesium. Up to 80% of Americans are. Are you one of those? Let's take the quiz. As we go through this, an affirmative, a positive, a yes response is 1 point. Keep track as we go. Do you drink alcohol daily? Or have you done that daily in the past? And I'm not talking about a week of alcohol. I'm talking 5 years, long term. Have you had alcohol consumption on a daily basis for a long period of time? Have you engaged in extreme endurance type exercise or work in the heat for long periods of time? If so, give yourself a point. Are you plagued with insomnia or emotional challenges such as depression, stress, anxiety, anger, irritability, confusion, memory or concentration problems, hyperactivity, apathy, or have you had a history of seizures? Extremely low magnesium can lead to a seizure. Do you have any type of cardiovascular disease, hypertension, irregular heartbeats? Do you have asthma, shortness of breath, chronic bronchitis, or emphysema? If you have several of those, give multiple points. Low calcium or low potassium levels. Remember those electrolytes. If you've ever been told, boy, your potassium's low, we better supplement you, think magnesium, give yourself a point. Irritable bowel syndrome, inflammatory bowel, anything that constipates or causes diarrhea or vomiting, protracted, you know, not a weekend, a bad weekend. I'm talking protracted problems like that. Have you had major surgery? Any trauma, any major surgery is a dramatic diuresis of magnesium. We waste a lot in trauma. Keep track of that. Closed head trauma, concussions. That's famous for that. Traumatic brain injury. Low magnesium. More than 3 servings of caffeine containing beverages a day for prolonged periods. Coffee, tea, chocolate, large amounts. It can deplete magnesium. Chronic pain, chronic fatigue, fibromyalgia, migraines, that's a big one, frequent headaches, muscle irritability. These are your most common symptoms. Pay attention to that. Give yourself a point. Cold extremities, muscle cramps, cramps that wake you in the night. You take the potassium, you still get them. Think magnesium. Raynaud's phenomena, restless leg syndrome. These can all be related to magnesium. Diabetes, any type of diabetes. Diabetes is a magnesium wasting disease. Do you rarely eat raw fruits and vegetables? Do whole foods mean nothing to you? Is a whole food the whole order of French fries? Is that what that is? Is that what whole foods are? Then you're at risk for magnesium deficiency. Only whole foods have adequate magnesium amounts. Any processed refined foods, nope, sorry. Do you, sugar. Sugar is also a magnesium waster. Are you a sweet tooth? You know, every day there's something sweet. You're at risk. Do you have trouble swallowing your foods? Have you had polycystic ovarian disease, very much like diabetes, infertility, PMS, or painful periods? Give yourself a point. Some people are racking up a big score here, aren't they? Kidney stones. When we're low in magnesium, that calcium makes stones. Remember, it antagonizes calcium. Any calcium problem, think magnesium deficiency. Do you take diuretics, antibiotics, long-term, like acne treatment? You know? Steroids. Oral contraceptives, hormone replacement medicine, hormone replacement therapy, seizure medication for any reason, whether it's chronic pain or seizures, it depletes magnesium, these seizure medicines. Now, you may have to take them, I get that, but take a little magnesium with it. Next, mercury amalgams, dental fillings, mercury. Have you had osteoporosis, hyperactive parathyroid, or hyperactive thyroid, hyperparathyroid? Any thyroid or parathyroid condition, think magnesium. Cancer, chemotherapy, radiation for cancer. Chemotherapy is what caused my magnesium deficiency. It just wasted my magnesium away. I had a very difficult time getting it up, but it's up. I'm doing good now. Thank you very much. Have you been a smoker? Have you had a stroke or a transient ischemic attack? Have you had a liver or kidney transplant? All right, add up your marks. Add them up. 0 to 2, you're really doing well. I'm very proud of you. You're living the good life. Keep doing what you're doing. Take your daily multiple vitamin and mineral for maintenance to keep you in good health. 3 to 4 points, you're on the edge. It could go either way depending on what you do. Start eating healthy. Supplement your magnesium around 500 milligrams a day. Get yourself out of trouble. If you have 5 to 8 points, you're struggling. You don't feel well. And the doctors are not helping you much, are they? One drug after another, they're not getting to the real cause of your problem. And I think you're learning why you have that problem. It's probably magnesium. You need help. You need magnesium supplementation, 5 to 8 points. Magnesium supplementation both internally and topically. We'll get to that part in a minute. Improve your diet and your lifestyle practices. Take the steps. Counter those agents we just talked about. 9 and above, you need professional help. You really do. You need to see a doctor who's experienced in helping people with magnesium deficiencies, and ask for a magnesium challenge test. Ask for one of the new tests. And possibly you may require intravenous or intramuscular magnesium injections. Oral supplementation will be a part of it, but you may need to take large doses under the supervision of a doctor to improve your status. This is very common in today's world. You're not out on a limb. It's not even alternative. It's standard medical care today, okay? But this is so important. And once you get your levels up, then you can go on with your supplementation plan and keep them good. In the moments we have before the break, let's get into a little bit of our research. There is so much to learn about magnesium. I hope I'm doing it justice with our short 1-hour program. Magnesium is the conductor of your body's biological symphony, orchestrating the proper function of approximately 80% of your body's metabolic processes. Dr. Dennis Goodman, MD cardiologist, wrote a book named Magnificent Magnesium. He was a guest on this program. He is a brilliant man, a kind, caring cardiologist, and he says 80% of how your body works is dependent on magnesium. How in the world could it work properly if we're low? Well, it can't. Listen to the good doctor. Pay attention. The first recorded use of magnesium was by Dr. Nehemiah Grew. Nehemiah Grew, he identified that the springs in Epsom, England, contained magnesium sulfate. People would come from all over England to soak in Epsom, England's spa water. And they would evaporate off the water and create Epsom salts, and they'd take that home with them to support their needs. But it wasn't until 1920 they found magnesium in humans. In 1935, they found it was essential. We'll be back with more on magnesium.
I'm Cindy Becker.
And I'm Dr. Richard Becker. Are you thinking about your health as we approach a new year? Well, many of us do, even though our health is important every day of the year.
If you have a wellness plan in mind, December's a month with special holiday prices. Plus, shipping within the continental U.S. is free for all orders over $50.
We'd like to thank you for your continued support. It's because of you that we are able to provide this great educational service.
So call us today to restock your supplements for the coming year and tell a friend about the savings, or order online at bioinnovations.net for the best prices of the season.
We hope the new year brings you happiness and better health for your entire family. Merry Christmas.
And a happy, healthy new year.
I'm Cindy Becker, and this is Your Health at a Glance. Are you following a low-fat diet? While it's true that too much fat makes us overweight, certain types of fat are actually good for us. Add to your diet omega-3 fats such as fish and flaxseed oil, and omega-9 oleic acid found in olive oil. And reduce in your diet omega-6 found in corn, safflower, and peanut oil, and saturated fats found in meats and whole milk dairy products. Studies show those fats can promote inflammation and chronic disease. The Mediterranean diet can help you make good choices, such as fruits, vegetables, whole grains, lean meats, fish, olives, and olive oil. So remember, increase omega-3 and omega-9 fats. Reduce omega-6 and saturated fat. For Your Health at a Glance, I'm Cindy Becker.
For centuries, the herb astragalus has been a staple of traditional Chinese medicine. It's used to create a strong shield, protecting the immune system.
Astragalus is also used to support healthy heart and lung function.
There's even more. Astragalus helps to calm total body inflammation, a common cause of pain and chronic illness.
All of that without the use of medication.
That's right. Support your health the way nature intended with astragalus root.
BioInnovations brings you Dr. Becker's Bionutrients Astragalus Root Extract. BioInnovations is the affordable source that you can trust for all your vitamin and supplement needs. Give us a call at 888-442-2120 or order online at bioinnovations.net and see what astragalus can do for your health. That number once again is 888-442-2120. Call today. We're back, everyone. I just want to let you know it is holiday celebration time at BioInnovations. Best prices of the season. What a celebration we are having. Best prices and free shipping on orders over $50 in the mainland USA, so don't miss that one. Richard, these studies are just amazing.
They are, and when you think that we've only known that magnesium is essential for 80-some years, it's you can understand how that we're maybe a little behind on what all it can do for us. You know, it's not a drug. There's not a wealthy drug company promoting its use. It's up to us to help us understand how to use it best. Now, if you were to review all the literature on the uses of magnesium, you would find that the United States, USA accepted treatment guidelines for the use of magnesium include the following conditions. What I'm saying here, standard of care says, use magnesium for this. All doctors should know this. And they do. This is common knowledge in the field of medicine today. What are they? Preeclampsia, you know, this is the seizures associated with pregnancy. Magnesium is the best treatment we know of. Arrhythmias of the heart, certain arrhythmias respond beautifully to magnesium. Migraine headaches, asthma, superrefractory status epilepticus. What that means is this is epilepsy that does not respond super refractory to any of the medicines. The magnesium level is either so low, or we can use magnesium as a drug to calm the excitability of the brain, that it is the drug of choice for super refractory epilepsy. Does that make sense? That's standard of care today. Muscle cramps, it's common to use it for that, and subarachnoid hemorrhage. Also, it's used in myocardial infarction. That's why all the heart doctors talk about it and rave about it. Hypertension and traumatic brain injury. But that's standard of care. There's so much more, and I'd like to highlight some of these new and unique uses of magnesium, if that's all right. Again, magnesium controls the cellular clock, metabolic rate, and type. If you're having trouble gaining weight, trouble sleeping, think magnesium. It can set you straight onto track. As magnesium levels drop, total body inflammation increases. So don't just take countering agents like your ibuprofen to calm that achy stuff. Take the magnesium and let your body have what it needs so it can naturally calm the inflammation down. Multiple population studies now show as magnesium content of water, soil, and diet decreases, as magnesium drops, cardiovascular disease, diabetes, cancer increases. And 68% of Americans do not ingest enough magnesium. Multiple studies, 60% of critically ill patients are low in magnesium. If you're in the intensive care, if you're so sick you need to be in intensive care, there's a good chance, 60%, that you are magnesium deficient, and I just hope your doctor checks your level. I hope and pray for that. We're getting better at this, folks. You know, doctors are responsible for a lot. It's not an easy job. Trust me, I've done it. We're getting better. But if you're that sick, please take magnesium, please. Dietary intake is low. We've talked about that. Magnesium supports energy transfer. This is why it's so important for cardiovascular disease. And one of our first examples of this ever described in the scientific literature, it was observed that in northern Finland, they have very high cardiovascular disease and heart attack rates. In southern Finland, they have low heart attack rates. And they determined that in northern Finland, their water is magnesium deficient. In southern Finland, it's rich in magnesium. So that was one of the first indicators to help us understand that magnesium helps the heart. Swedish researchers found those with high magnesium content water 19% lower risk of death from heart attack and 80% lower risk of coronary artery lesions. Dramatic reduction in coronary artery lesions. Remember, magnesium counters calcium. The coronary artery lesion becomes dangerous when it is infiltrated with inflammatory calcium. It breaks loose and causes your heart attack. If the magnesium is good, you can have the plaque without the heart disease. Because 18-year-olds will have coronary artery plaques, but they're not rupturing loose. Magnesium helps prevent heart attacks and sudden death. Magnesium, a prescription for cardiovascular disease. It lowers inflammation. It lowers lipids. It lowers free radicals. It lowers platelet aggregation, this propensity to clot. And it lowers the progression of arterial thickening, this hardening of the arteries. It opposes calcium. It reduces arrhythmias and a 37% reduction in sudden death risk. Now, sudden death risk is different than heart attack risk. Sudden death risk, what doctors call that is due to a problem related to the rate and rhythm, the arrhythmias of the heart. That's the sudden death risk. Now, it may be related to a heart attack and past damage from heart attacks, but it's a different thing. So when you think of the regularity of heart rate and rhythm, magnesium is absolutely involved in that. A new Japanese study, as magnesium decreases, increasing hemorrhagic stroke, death from stroke in men, and death from ischemic stroke, coronary artery disease, heart failure, and total cardiovascular disease in women. That's in the Japanese culture, and it translates to some degree, at least, into our culture as well. Alleviates the symptoms of mitral valve prolapse, lowers the incidence of angina. This is why the heart doctors love it for their patients. Helps to dissolve blood clots. You know, we're making clots all the time. But you get in trouble when that clot propagates, gets bigger and bigger and bigger. Magnesium helps to counter that progression of the clot. That helps save lives. Controls blood pressure. This is very important. If you take just 120 milligrams of magnesium, it lowers your pressure about 4.5 points over 2 points. Systolic over diastolic. If your blood pressure is over 150, you have hypertension. That same 120 milligrams, guess what? It lowers it 20 systolic and 10 diastolic. Hypertensives, you're low on vitamin D and magnesium. You start doing that, you're going to respond better to your medicines. We'll be back in a minute.
Cindy Becker.
And I'm Dr. Richard Becker. Are you thinking about your health as we approach a new year? Well, many of us do, even though our health is important every day of the year.
If you have a wellness plan in mind, December's a month with special holiday prices. Plus, shipping within the continental U.S. is free for all orders over $50.
We'd like to thank you for your continued support. It's because of you that we are able to provide this great educational service.
So call us today to restock your supplements for the coming year and tell a friend about the savings, or order online at bioinnovations.net for the best prices of the season.
We hope the new year brings you happiness and better health for your entire family. Merry Christmas.
And a happy, healthy new year. Is our hope for you today. I'm Cindy Becker. When we struggle with disease and painful health conditions, we can become overwhelmed with negative thoughts. We may even develop depression. The Apostle Paul offered guidelines to help us preserve a positive attitude during times of trouble. He wrote in Philippians 4, verse 8, "Whatever is true, whatever is noble, whatever is right, whatever is admirable, if anything is excellent or praiseworthy, think about such things." Thinking positive thoughts is the first step toward overcoming worry, even depression. Proverbs 17, verse 22 reminds us, "A cheerful heart is good medicine, but a crushed spirit dries up the bones." Remember these words of wisdom as you face your health challenges. I'm Cindy Becker. This is our hope for you today.
Do you believe that nature holds the answer to your health needs? Are you looking for a supplement that's simple and pure, yet really works?
If you're looking for nature's answer to better health, look to Aloha Noni Juice. It's pure and fresh, just like nature intended. Aloha Noni Juice is brought to you direct from the islands of Polynesia.
Aloha Noni Juice is 100% pure with no added sugar or sweet fruit fillers. It's the perfect addition to your low-sugar diet.
Aloha Noni Juice drinkers will tell you their vitality, energy, and sense of well-being have improved, along with relief from many painful conditions. Made by nature, proven by science, Aloha Noni Juice contains only nature's best.
And now you can enjoy the benefits of our new 100% certified organic Noni Juice.
Order online or call 888-442-2120 and let BioInnovations assist you in making the right choices to better health. Ask about the AutoShip program for additional savings. We're back, everyone. Just a little reminder, it is holiday savings time at BioInnovations. Best prices of the season and free shipping on your orders over $50 in the mainland USA. So great time to get the supplements you need as well as that all-important magnesium. So Richard,
Yes.
there's so much to go over.
We
This is
talked
just
about
amazing.
cardiovascular disease and the
Yes.
importance of magnesium. How about for diabetes? It is estimated from good studies that over 80% of all type 2 diabetics in America are tragically low in magnesium. 80%. And when that happens, our blood glucoses become very hard to manage. If you start to supplement your magnesium, diabetics, you're going to have improved insulin function. You're going to have improved measures of glucose control. Your cholesterol levels will come down. Your blood vessels will function better, endothelial function improves, as it were, insulin resistance drops, and your total body inflammation drops. All just from magnesium. You need it for other reasons anyway, diabetics. Please get on the magnesium. Next, fibromyalgia. Boy, that's a painful condition. I remember working with the fibromyalgia patients. It's such a challenge. Magnesium calms this process down. It helps with the pain of fibromyalgia. Also, new area of study for magnesium. If you give somebody who's had a stroke, a bad stroke, within 3 hours magnesium, give them magnesium within 3 hours of having that stroke, they are 60% less likely to die. Isn't that amazing? And it's because magnesium counters the excitotoxicity that occurs with the stroke. This also means that magnesium is an excellent MSG, monosodium glutamate antidote. I'm very sensitive to MSG. If I get some food with MSG, I don't feel well. If that happens to me, I take a couple magnesium pills, and within 20 minutes, that with a glass of water, I feel better. I have proven this to myself many times over. And so the urgent, emergent concept of that is stroke therapy. I would love to see more doctors giving magnesium to stroke patients. Major cause of disability. Traumatic brain injury. Get to it early, doctors. It reduces the damage to the brain. Osteoporosis. Hydroxyapatite is the mineral complex of the bone, and surrounding that calcium and phosphorus complex is a water layer. Bone is moist. In that water layer is magnesium. Magnesium dictates the laying down of the minerals in the bone. It is more effective in restoring bone mass than calcium. 100 milligrams of magnesium a day increases your bone mineral density by 1%. 600 milligrams a day increases your bone mineral density by 11%. The drugs used today to treat osteoporosis, 2%, 3%, maybe 4% if you're extremely lucky. 3% is what we tell people. That's what you can get out of this therapy. 600 milligrams a day gives you 11% magnesium. We're missing the boat on osteoporosis. It's magnesium. Works best combination with calcium and good healthy lifestyle, weight-bearing exercise. But we're neglecting magnesium in our osteoporosis mineral supplementation. Don't fall for that, folks. Don't fall for it. Ophthalmic disease, there's evidence that cataracts, glaucoma, and diabetic retinopathy are in some way related to magnesium. Urinary stress incontinence, a very common problem for women. It improves these symptoms. Less leakage. This is a good thing. Constipation. Who hasn't heard of milk of magnesia for constipation? One of the best therapies ever, and you don't become dependent on it. Why? It's an essential mineral. You got to have it. It's wonderful. If you struggle with chronic constipation, anywhere from 1 to 3 teaspoons a day, all the way up to an ounce, which would be 6 teaspoons a day of milk of magnesia, it's going to set you right. It really does. It makes all the difference in the world. I've worked with hundreds of patients with chronic constipation. If I only had one agent to help people with their chronic constipation, I don't mean just a little backed up. I mean no matter what you just can't go. Okay, let's be honest. If I only could have one thing, it'd be milk of magnesia. Really, it works. It helps a lot. Asthma. Magnesia works the best in asthmatic children. It is phenomenal in asthmatic children, but it serves a purpose in adults too. Frequency of attack, severity of attack, hospitalizations. It can be used as an emergent basis, IV administration of magnesium for asthma. It can be used orally to help prevent. But please, whatever you do, if you're an asthmatic, include magnesium in your treatment. There's more. Attention deficit hyperactivity. I remember Dr. Marianne Block being here, who's an expert in hyperactivity. Magnesium, magnesium, magnesium. She has treated hundreds, if not thousands of children for hypertension, hyperactivity attention deficit syndrome. And she uses magnesium in virtually every one with good results. Good results. Hyperactivity. Chronic depression. You can't make serotonin without vitamin B6 and magnesium. Lift the mood. Lift the mood with magnesium. It's essential. There's so much to know. Hearing. Are you suffering from hearing loss? Carpenter, heavy equipment operator, maybe airport. You work around a lot of noise, and you're the guy who says, "Pardon me, huh?" Well, they've been able to show a regular pattern of magnesium supplementation can actually help to reverse the hearing loss from noise exposure. We thought for decades that it was not reversible, but we're finding now with a pattern of daily use, it can help improve your hearing. That's good to know. It supports immunity. It is the T lymphocyte development. Got to have magnesium for that. It relieves PMS. It improves the PMS in 96% of the women who use magnesium for PMS. That is a great benefit. You do the women's kit with some curcumin and vitamin D, those issues are going to get a lot better, ladies. Believe me, please believe me. Restless leg syndrome. You know, the drugs they give for restless leg after 18 months, you know what's going to happen? Your restless leg's going to be worse than it's ever been. That's what happens. But if you take magnesium, it's going to be better than it's ever been. This is magnesium. It's the most amazing thing I've ever encountered. And it's essential. And nobody wants to talk about it. Why is that? I have questions. I do. I have questions. Well, let's go to our break, but when we return, let's talk about what are the best foods to help support your magnesium level naturally. We'll be right back.
I'm Cindy Becker.
And I'm Dr. Richard Becker. Are you thinking about your health as we approach a new year? Well, many of us do, even though our health is important every day of the year.
If you have a wellness plan in mind, December's a month with special holiday prices. Plus, shipping within the continental U.S. is free for all orders over $50.
We'd like to thank you for your continued support. It's because of you that we are able to provide this great educational service.
So call us today to restock your supplements for the coming year and tell a friend about the savings, or order online at bioinnovations.net for the best prices of the season.
We hope the new year brings you happiness and better health for your entire family. Merry Christmas.
And a happy, healthy new year. I'm Cindy Becker for Your Health at a Glance. Each year, more than 76 million Americans contract food poisoning. Most cases are caused by tainted fruits and vegetables, especially contaminated leafy lettuce. But poultry causes the most food poisoning-related deaths. To prevent food poisoning, follow these simple rules. Thoroughly wash all fruits and vegetables. When preparing any kind of meat, wash your hands, utensils, and work area before preparing any other food. Cook thoroughly chicken and ground meats. Store leftovers in the refrigerator immediately. Look for expiration dates when you shop. If you use reusable grocery totes, wash them periodically. And finally, use spices such as garlic and oregano to inhibit the growth of bacteria that cause food poisoning. Food safety lowers your risk significantly of getting sick. For Your Health at a Glance, I'm Cindy Becker. Are you one of the 62 million Americans suffering from gastrointestinal problems? Do you struggle with other chronic conditions? That's why we offer Dr. Becker's Bionutrient Probiotics.
After years of research, we developed a revolutionary probiotic formula with gastrodefense technology. This system protects the good bacteria from stomach acid so the probiotics reach the intestines where they go to work. Additionally, we use live count technology to prolong the shelf life of the probiotics, so there's no need for refrigeration.
Dr. Becker's Bionutrient Probiotics is a powerful combination and one of the most effective formulas available today. And we offer a children's chewable formula too, both at prices you can afford. Order online at bioinnovations.net or call 888-442-2120 and ask about the auto ship program for additional savings. Health is brought to you by BioInnovations, trusted products for your health and well-being.
We're back. Just a quick reminder, it is holiday savings time at BioInnovations, so don't miss that one. So Richard, what foods would we find magnesium in?
Well, first, the groundwater supplies us, you know, our municipal water supply supplies us with the magnesium. However, the further west you go in North America, the lower the magnesium content of our water is. It only supplies about 10% of our need, but over time, if you're in low magnesium level water, if that's what you're consuming, it could add up to a deficiency. All vegetables have good magnesium, especially the green leafy vegetables. The greener the better. So spinach, chard, romaine, the dark green lettuces are very good for magnesium. Fruits, all of your fruits, molasses, honey, maple syrup. If you want something sweet, white sugar, refined sugars are dangerous for magnesium. Not only does it not have any magnesium, it has the effect on the system of depleting magnesium. But molasses, honey, maple syrup, natural products, it's rich in magnesium. Isn't that interesting? And it's much more satisfying. I don't need as much molasses, you know what I'm saying, as white sugar. So that's a good thing. Whole grains, the bran component of the whole grain contains the magnesium. Nuts, seeds, beans, milk, eggs, fish, particularly tuna. Any refined processed fast foods are virtually depleted of magnesium. Stay away from them. The recommended daily allowance intake, 320 milligrams a day for women, 420 milligrams a day for men. 320 women, 420 men. But experts in magnesium say that's not enough. It's closer to 500 is best, closer to 500. Too much oral magnesium can lead to diarrhea. Milk of magnesia, that can happen, but you have to push the dose up, and you'll find it if you push the dose. But our bodies compensate. See, that's not dangerous. Your body will take care of that. Now, it may be inconvenient for you, but it's not a dangerous thing. I wouldn't keep doing that, but in any event. Also, don't forget the topical magnesium gel. That's magnesium chloride. Apply it right to the skin. You avoid the intestinal irritation completely from high-dose magnesium. Put it on the skin. It absorbs. We have studies that prove that. Now, we offered to you magnesium chelate. This is magnesium attached to an amino acid, and it slowly releases the magnesium into your system. See, the magnesium hydroxide dumps magnesium into your system, and that can create diarrhea. We don't want that. Diarrhea will deplete your magnesium. So the chelate slowly releases. It's like a time-released magnesium, so you get the most out of your 2 capsules of magnesium to be at 500 a day. And if you're severely depleted, you can take higher levels. Your body will absorb it. It'll take it in a lot quicker than you can reduce the dose as you've replaced your levels. But please, whatever you do, replace your magnesium. Then your body has a chance to heal, the pain has a chance to go away, and vitality may return for you even yet. Thank you for your kind attention. Merry Christmas, everybody. Bye-bye.
Thanks, everyone. Bye-bye.
In the pit of my stomach, I knew it was going to be positive. I wouldn't be in this situation I would have even been taking it if I didn't think it was going to be positive, but I didn't want to admit that. I turned it over, and there were 2 lines. It was a positive test. I remember just being like, oh no. Like, that was all that really went through my head. I didn't know what to do.
Hear the stories and experience the freedom on Real Life.
This week on Our Jewish Roots, we begin our examination of the kings of ancient Israel and Judah in our series, Kings and Kingdom, with dramatic